live right at noon, so I think we're going to go ahead and get started. And want to welcome everybody to our Dairy Goat webinar series. My name is Jennifer Bentley, and I work as a dairy field specialist with Iowa State University Extension and Outreach, and I'm housed in Northeast Iowa. And this is a webinar series put on by our Extension Dairy team, and you can see by the presentation slide here today, we're going to be talking about antimicrobial stewardship in dairy goats, and with Dr. Pat Gorden with the ISU Vet College here. You do see here, this is part of a Sustainable Dairy Goat Agri-Systems USDA funded grant project. And so as we go through our webinar series here this year, you're going to learn more about that project, but I do encourage you to visit the website that we do have now live, dairygoagrisystems.org, if you want to check out what the project is about. And then as we build content into that website, you'll be able to learn more about the educational materials that are being developed for that as well. These webinars are also approved for ARPAS continuing education credits. So if you are part of that, you can go ahead and use that as part of your continuing education credits here today. So with that, we're going to go ahead and get started. And I want to thank Dr. Pat Gorden for joining us today. And a little background about Dr. Gorden. He is a 1993 graduate of Iowa State University College of Vet Medicine. And following graduation, he was in private practice for about 14 years in Wisconsin and Arizona. And so while he enjoys helping producers maintain the health of their herds, his real passion is in the development of quality milk programs and milking equipment evaluation. In 2007, Pat joined the faculty at ISU's College of Veterinary Medicine, where he's a professor specializing in dairy production medicine. His duties include providing clinical service to dairy clients, teaching dairy production medicine to vet students, applied research projects in dairy, cattle, and goats, and departmental administration. His passion for milk quality and milking equipment performance has continued, but morphed to include prevention of drug residues in milk and dairy beef, the biology of drug metabolism in health-compromised animals, and antimicrobial resistance in dairy animals and their products. So with that, Dr. Gorden, I'm going to stop sharing my screen here, and you should
Okay.
be able to share.
And you can hear me okay still? Good afternoon, at least if you're here in Iowa or east of here. Um, Fred, that was a great idea to have people sign in where they're um, where they're coming from today, because I've seen that we have Canadian and we have Mexican participants. And so as we talk through some of the legalities here um, about drug use in dairy in small ruminants, and is primarily going to focus on dairy because our research has been in the dairy goat world. I'm going to be focusing on US regulations. And so as we talk about regulatory components, that may be slightly different in Canada or in Mexico. So I just want to put that out there right away. So as Jen said, this is part of a sustainability grant that we were part of, or are part of here at Iowa State, and really quite a few universities from around the country. And this is also some continuation of a project that I was involved with Dr. Michelle Buckley, who was a graduate student here at Iowa State, who is going to graduate with her PhD today, and now is on staff down at Texas Tech University at their College of Veterinary Medicine. And so the majority of the work that I'm going to present here about the goat therapy stuff that we've did was a previous USDA grant in which the extension group was with us on. So I need to acknowledge her work because she's really the sweat and tears behind the majority of what we're going to present today, and also the extension group to help that has helped put this material together. So a lot of the materials from this previous study are going to be available through that website, that the sustainability website that Jen mentioned. So I want to talk a little bit today about legal guidance to drug use in general, big picture, all drug use. We'll kind of focus on antimicrobials just a little bit also, because we're talking about antimicrobial stewardship, but it really applies across. We'll talk about residue prevention when we utilize these drugs in animals. Talk about risk reward of antimicrobial use, and use as an example dry therapy in lactating goats. Sorry, I keep moving my. Okay, so legally, why are there legal regulations around drug use in? Oops, sorry, trying to get myself where I can see my screen. Um, Around drug use in animals. And the major reason is that we have a very limited number of antimicrobials available in veterinary medicine, and many of those cross over into human medicine. So this is a FDA guidance in the United States on importance of drugs, not to veterinary medicine doctors, but to human medical doctors as far as critically and highly important and important categories, and those that really only have an animal use over here on the not important category, so have very no use um, for use in humans. And so this is an ongoing process of building this and maintaining this grouping or categorization of antimicrobials, and is currently being worked on. It has been worked on for the last 2 or 3 years, actually. And so I don't really know the exact status of the new version of this classification system. But needless to say, the important thing about this slide here is that the majority of the antibiotics that we use in veterinary medicine, the same class or even the same drugs, are used in human medicine. And so human medical doctors are always concerned about the development of resistance, just like we are in veterinary medicine. But their concern is also related to our use of the drugs in animals, and how that potentially that resistance could spread through contacts of consumption of foods, whatnot, from animals into humans. And I think that's important to realize that this is not
Oh,
only
you
going
have a friend.
not only food animals, but it could also be from pets too, that would be treated with antimicrobials that are in close association with people all the time. So as we kind of set the stage for how drugs are used in small ruminant species, the US FDA classifies, again, big picture categories of use of animals into major and minor use species. And the major use ones are cattle, pigs, chickens, and turkeys. And then minor use species are all of the other food animal species. So goats and sheep would fit into the minor use species. And that's an important designation because it has some guidance on what we can do from a drug use standpoint under the minor use classification. It's also important to realize that for veterinarians, we need to think about our drug use selections as the fact that if an animal could be a food animal, so it's a sheep or a goat or a rabbit, but it could also be a pet, the FDA provides guidance to the veterinarians as far as how these drugs can be used as if they're food animals. So we always need to consider that while an animal may be a pet today, at some point down the road, it may be passed on through whatever means to another person who would consider it to be a food animal and put that animal into the food chain. So we need to keep that into consideration. Probably the biggest take-home point for small ruminant producers is that there are virtually no drugs compared to other species approved in sheep and goats. A couple of antibiotics, a few anthelmintics, but the majority of the products are approved for other food animal species or human species. So the FDA, in recognizing that and recognizing the cost process for drug companies to bring drugs to approval, was very limited as a return on investment for drug companies, has provided some legal provisions in the Federal Register to allow veterinarians directly or under their direction to their clients to practice what we call extra label drug use. And it was through the Animal Medicinal Drug Use Clarification Act that legalization became final in the 1990s. We refer to it just sweetly as MDUCA in our world of veterinary medicine. So in order for a drug to be used in an extra label manner, which means that it has to be used in a labeled manner, the species of animal being treated needs to be listed on the label. The condition treated needs to be listed on the label. So for example, pneumonia, foot rot, mastitis would be listed on the label. And then there are specific directions on how to administer that drug. So you have a dose, you have a duration, and a frequency of which that drug would be labeled for. Any derivation of that, even going from a drug that's labeled for respiratory disease in cattle and using it for respiratory disease in cattle, but giving a higher dose or more frequent dose is considered to be extra label. And so when we go to that category, veterinarians have the privilege to either do it themselves or supervise by providing you a protocol or a script as a producer, the allowance to use that drug in that extra label manner. It can only be FDA approved animal or human drugs. So we have some drugs like that only are available in a human form that work in animals, and we do it in cattle and goats all the time, provided they're FDA approved on the human side also. FDA approval is primarily everything that's going to have a effective outcome. It's going to change the physiological process or bacterial growth within a particular individual that it's injected, and would be exclusive of the external parasitic control drugs. So if we have a drug that's supposed to control an external parasite like lice, that drug would actually be controlled by the Environmental Protection Agency. But if we have a drug that would and it's only applied topically, it has no internal use within its usage formulation, then it'd be controlled by the Environmental Protection Agency. There is no allowance for extra label use for EPA guidance drugs. But if it's a product that you would give orally or injectable for parasite control, then it would have an FDA approval, and therefore we could potentially do extra label use. It can only be for therapeutics. It can't be done to enhance production. So we can't give a drug to make an animal produce more milk, as an example, or to grow faster. A veterinarian needs to be in the relationship, and you have to have a client and a patient. That's very well defined within the FDA and within state veterinary practice acts. There needs to be record keeping in place to show that this happened and when it happened, how it happened, in case there's ever a violative residue down the road. It also helps with the determination of whether an animal is ready to go into the food chain, if that's the end use for that animal. And it cannot result in a violative residue in either the meat or the milk. Probably the most important thing here is that we cannot have drug residues present. So it's recommended that we provide an extended withdrawal period. That's also assuming that we actually have a withdrawal period in place, which, because we don't have any or very few drugs approved for small ruminants, we have no idea on what the withdrawal period should be. And that was part of the work that I'll share with you later that we did here to try to get a better understanding, at least in goats, on some products. Okay, so what's a residue? A residue is essentially anything that's abnormal to us or to our bodies. Okay. So to kind of get to that, let's kind of step back, because I need to establish what legal means. Whenever we get a drug that goes through the drug approval process, there are several technical sections that the drug sponsor or the manufacturer, the person that's going to, the company that's going to manufacture the drug in the future has to do and present to the FDA for approval. Okay. Um, the residue components come out of the human food safety technical section in order to get that drug approved. So in order to do that, they conduct a residue elimination study in the target animal species. So with the species that it's going to be labeled for. So if we had a drug that they were going to utilize in goats, they would have to do the study in goats. If it was going to be a lactating product, they need to do it in dairy goats. So they go through, they dose several animals, they measure the depletion of the drug in the target tissues. If it's milk, that would be the target tissue. And then they do an analysis of the data to look at the depletion curve. So at the end of the determined withdrawal time, there can be less than 1 in 1,000 animals that may have a drug residue present above a regulatory limit. And that's typically called a tolerance in that species. This also could be in eggs. It can be in meat. So it's dependent upon the different species that the drug is going to be approved for at the end of the whole approval process. Okay, withdrawal times are official. That means that we need to wait at least that long in the labeled species that we're using it in. Okay, on the milk side, they're listed in hours. On the meat side, they're listed in days. Okay, they're listed in hours on the milk side because people use different frequencies of milking. And so they used to be in milkings when everything was 2 times a day, but then 3 times a day, the FDA just decided that hours made more sense. So that you'll see a slightly different designation as far as the time interval that's listed here. Okay. These withdrawal periods are only good in the species that they're labeled for. So when we take a bovine intermammary product, and use it in a goat, the withdrawal time is unknown. Typically, smaller animals clear drugs faster, but that's not always the case. And so extrapolating bovine withdrawals is somewhat limited in its utility. Okay. The tissue that they utilize to determine that is usually the tissue that holds the drug the longest. So it's usually liver or kidney, sometimes muscle. And like I said, if we have to go into a extra label situation, like I'm going to talk about here in a minute for intermammary use in goats, that could be based on research. Okay, there's a little bit of research out there on using intermammary bovine drugs in goats. And when I say little, I mean almost none until Dr. Buckley completed the project that she's completed and is now going through publication. Or we have to extrapolate that from the bovine data set. So when a veterinarian prescribes a product for your use on your farm, we'll use an organization that goes by the acronym FARAD for Food Animal Residue Avoidance Database, which is housed out at North Carolina State and is funded by the USDA. And they will go in and look at the current information that's available, the research that's available, or they look at the bovine data sets and try to apply the dynamics that happen in goats compared to bovines and give the veterinarian who requests this a milk withholding interval. It's got a slightly different term when we have to do things with an extra label manner. A withdrawal time on a box of mastitis tubes is a FDA determined withdrawal time based on the research. When we go to FARAD, they're going to give us a withholding interval based on the information that they can find. So it's not going to be as precise, and they factor that into their recommendation when they provide that to the veterinarian who requests this particular piece of information. So why do we care? Why do we get concerned about drug residues? Okay. Because of the fact that we may have human exposure and maybe the potential of having allergic reactions to that exposure, or the other thing is we have active properties here. We could create some antimicrobial resistance. So those are the big things. Okay. So let's come back to my conversation about residues and violative and non-violative. Okay. So a residue is any substance that's foreign to our body. Okay. If I always use the example, when I handle dollar bills, there's people use dollar bills to inhale cocaine, I guess. I don't know. If you handle a dollar bill, you will, through your skin, absorb some of that cocaine residue that's left on those dollar bills. Okay, that's a residue. In our case, we're concerned about residues that are left over after we administer a drug, whether it be an antibiotic, it could be an anti-inflammatory, it could be something like an anthelmintic that controls internal and external parasites. Okay. Anything that's abnormal is considered to be a residue. Alternatively, we have the violative residue, which is, in this case, again, a drug residue that's going to be found in the body or in the tissue of interest, milk, liver, kidney, whatever it is, above a stated regulatory limit. Again, that's a tolerance almost always in the regulatory language. So a violative residue means that a regulatory agent has taken the milk or the meat that is marketed by producers and tests it and finds it to be at or above this regulatory limit. Then therefore it's considered to be violative. So I think it's important for us to understand is that we can market an animal that will have a little bit of drug residue present, but it may not be violative. Okay. And that tolerance is established based on the food safety studies that are done by the sponsor, by the drug sponsor, to show that with chronic ingestion of that particular residue in laboratory animals, they do not show any adverse effects as a result of consuming that. And that's how it gets to the end of having the established tolerance. Believe me, it's a very much longer process than anything that we've talked about today. There's volumes of guidances that are published for this. And so it's a very complicated process, and you could quickly realize why it takes so many dollars to get a drug approved in today's world. So again, residues can be violative or non-violative. So I think we need to always be careful about suggesting that the meat or the milk that we consume is residue free. It's violative residue free, but maybe not completely residue free. Okay, so how do we get there? How do we get residue testing completed? On the meat side, the USDA has several tiers of sampling that they do. And for animals that go to market, it's really in this tier 2 group. So when an animal goes into a processing plant to be where meat is going to be harvested, there's USDA inspectors present on the antemortem and the postmortem side. And if they judge an animal may have residue present, maybe it's lame, maybe it has a previous surgical incision, they will take that animal, take it to the side and do implant testing. And if that implant testing is positive, they will send it off to a central laboratory in St. Louis, and they'll do further very precise quantitative testing in order to quantify how much drug residue may be present. And if there is drug residue present, compare it to the legal limit. Okay. And that will give us to a situation whether we have a violative residue or not. On the milk side, it's much more simple, but much more frequent. And in small ruminant production, and primarily we're talking about goats here, we basically use the cattle system because we have nothing else. Okay. So we have a few of these ELISA type tests that are available. There's really two major companies that market these, which are set up to detect at the legal limit. And when they find that, we get a positive result. Either we have a machine read it, or there's two lines that you compare, one being darker than the other gives us a positive or a negative result. And so every load of milk that arrives at a processing plant is checked for the beta-lactam antibiotic class. Okay, so the penicillins and the cephalosporins of the world. Okay, and there's 6 different ones that we use in cattle and goats that are being looked at any given time. The tolerances for those drugs in the milk, whether it be cattle or goats, is exactly the same. So the test kind of goes across all species. It's much more developed in the dairy cattle world, obviously, because of the just number of animals that get marketed, or the amount of milk that gets marketed on any given day in the dairy sector. Okay, so as a veterinarian, what do they consider when they're prescribing these antibiotics? First of all, we have several antibiotics that are just illegal in for use in food producing species. Okay. Um, and so no matter what, we can't use those in any extra label manner. Okay. The one exception that you'll see down here is medicated feeds in small ruminants. In cattle and other major species, we cannot do extra label use of drugs in feed, but there is some guidance that allows us to do that in the small ruminant species. And so your veterinarian could prescribe a feed use that's not on label for small ruminants that they could not do in cattle. The other one that's here, listed here, is the fluoroquinolone class of antibiotics. So Baytril and several other respiratory antimicrobials. We have no guidance to be able to utilize those products in an extra label manner. So if the species is not listed on the label, like for example, if a sheep is not listed on the label of Baytril, I cannot prescribe that in an extra label manner. And the big reason there is the fluoroquinolone class is a very important class of antibiotics to the human medical doctors. And so that therefore the FDA Center for Veterinary Medicine has placed this restriction on veterinarians using this drug in an extra label manner. That becomes a bit of a one of the more common ways I see this drug being used in a violative manner is that veterinarians who provide services sometimes do that to small ruminants, despite the fact that they are mostly small animal veterinarians, and they don't understand the guidance that's necessary when we deal with food producing animals. And so if you're dealing with a veterinarian who primarily does small animal work, you may want to have a conversation about the legal use of some of these more powerful respiratory antibiotics. Okay. And then there's a few more restrictions. The big 2 here that we kind of have a bit of a difference. Sorry. Cephalosporins. So in cattle, we can't use cephalosporins in much of an extra label manner, but in minor species we can. And then also, if you're producing milk in grade A, the sulfas and the phenylbutozones would be considered to be illegal. And then also non-medical grade DMSO. So there's a few drugs that if you're in the grade A dairy world that you couldn't utilize on your operation. I do not believe currently there's any grade A dairy operations in Iowa, but I may be wrong on that. So if you're not a grade A dairy, those 2 last comments don't particularly pertain to you. Okay. And then as a veterinarian, we're always concerned about when we administer an antimicrobial, could it cause negative effects for future use, whether it be in animals or in veterinarians? And that's really becomes, or in animals or in humans, I'm sorry. And that becomes the point of prudent use, right? Whenever we administer a drug, it has to be eliminated through the body. It can go through the milk, or it can go out in urine and feces. And when it does that, it contaminates the environment. We're all in that environment. It also contaminates the meat potentially at meat harvest and is a potential for human consumption. Okay. Again, this is true for administering antibiotics to our pets, our horses, whatever. We still have the potential of sharing bacteria that are harboring antimicrobial resistance genes between us whenever we share environments like this. So we really want to minimize antimicrobial use to only the points at which it's actually necessary. Okay, so how do we get there? How do we legally use antimicrobials? And because it's an antimicrobial talk, um, on an operation. Okay, but this really it could pertain to other things like anti-inflammatories also. So as I said, we have a legal process underneath the extra label drug use provisions where a veterinarian needs to be in there. So number one, you're going to have to work with a veterinarian. Today, you cannot buy antibiotics anywhere except through a prescription route. So that means a veterinarian could write you a prescription and you can go to a pharmacy and have it filled, like Chewy or Walmart or whatever, or you can buy it directly from the veterinarian. That's on the antibiotic side. Okay. We want to make sure that we're only using antibiotics when they're truly effective. Whenever we are using drugs, we need to, in the food animal sector, we really have to document that use, both as the veterinarian and as the producer, because that becomes your legal documentation should there ever be a problem in the future. So we document the drug use, date, animal, route of administration, dose, withdrawal times, all those things, and we maintain those records for 2 years. The majority of the time, the majority of processors will never, ever have to utilize that information. But if your animal is marketed and they find a violative residue in the meat, as an example, the FDA has the right to come back to the farm and investigate why the drug got into the food chain, because now you've put it into commerce. And these records are going to be your lifeline to help you get out of the situation. Either you made a mistake or you actually followed everything and the animal just didn't eliminate the drug as quickly as it should have. On the milk side, probably the most common reason we have violative residues in milk in the dairy cow world is people treat them with antibiotics and then forget to mark them and don't segregate them. So really important to identify the animals visibly that have been treated. Okay. And if we're dealing with milk, in the dairy goat world or anything extra label, we want to test that milk with the appropriate drug residue detection kit. Okay. If it's a beta-lactam antimicrobial, that's easily found. If it's something else, that testing is more difficult. So as veterinarians, we have to prescribe a different route to test or prescribe an even longer withdrawal time in order to make sure that milk is safe for human consumption. Okay, so I'm going to go into a bit of an example. I'm still good on time. Kind of sharing some research that we've completed. Again, this is the study that I talked about at the beginning of the presentation, looking at mastitis therapy in dairy goats, and more appropriately, we were looking at utilizing it during the dry period for dairy goats, and I'll set that up here in a second. Okay, so in cattle and in goats, more so in goats though, the majority of the mastitis that we see is what we call subclinical. That means that when I take and look at the milk, it looks perfectly normal to me. However, there's an infection in that milk that is brewing in there that I can't see any visible results from. Okay, how do I know? Well, I could test the milk with a culture. I could do a bacterial culture. I could do some mechanism to determine whether or not there's increased somatic cells present in the milk. And somatic cells are essentially white blood cells that have migrated from the bloodstream into the milk in response to that infection. Or in goats, we have some physiological situations where somatic cells increase also. Or sometimes udder conformation can be an indicator. So when we see goats with lopsided udders, oftentimes that's an indication that they have a a subclinical infection with what we call a non-aureus staphylococcus cocci bacteria. And so that's an indication. And like CMT and somatic cell count, it's not a verification that there's an infection present. The only way we can verify is through the use of culture, some kind of a culture technique. It may be PCR, it may be agar plate, whatever it is, that would help us confirm what the actual bacteria present is. Okay. Goats rarely have clinical mastitis, and they rarely have severe cases of mastitis. It does happen with things like E. coli, but it's fairly uncommon. So we're not going to talk at all about clinical mastitis today in our example. So the most effective way to treat subclinical mastitis in dairy cows and in dairy goats is through the use of dry off therapy. So at the period of time where you are not milking that animal before it has its next offspring, we give animals oftentimes a dry period. Okay. And placing an antimicrobial in the mammary gland at that time is the most effective way to clear up those infections. Okay. So to kind of set the stage, we looked at about 16 to 1700 animals in our study in 3 different states, Iowa, Wisconsin, and California, at dry off, and took milk samples from those individual halves and went ahead and did culture on it. And this is our results. About 900 of those results were completely negative. We didn't grow anything. That's good. 600 of them, so about 2/3 of the no growth cases, had what we call a non-aureus staph. Okay. In the mastitis world, or bacteriology for a bacteria world, we have Staphylococcus aureus. Okay. And then we have this category of all the other Staphylococcus, and I'll show you a slide in a second, which kind of breaks this down more. That is what we call the non-aureus staphylococci. So NAS, whenever you see NAS in the preceding or the slides that follow here, we're talking about this category of non-aureus staph. And you can see we have a few Staph aureus, we have a few other things, and we had just a few contaminated samples. They did a really good job of getting nice, clean samples from all of the trot trips that we made out to these individual farms. So by far, if we're going to concentrate on something to treat in these animals, the non-aureus staph group are the ones. Okay. So based on our literature searches that we did, we thought that about 30 to 40% of all of the animals were going to be positive for an infection at dry off. And we hit that number almost right on the nose when we've got our data completed. When we looked at what the most common staphylococci are, Staph epidermidis was by far the most common one. We had some capri, we had some simulans, and then a few others in there, which is pretty consistent with the data that's been presented from around the United States. Okay. After we got these animals found, we were really interested in what can we use on these non-aureus staphs to treat them. So we did a study, a comparison of 2 dry-off therapies. One was Tomorrow, it's called cefepime, and one has 2 different names, either Dryclox or Orbenin, and it's a cloxacillin. Both of these would be considered to be in the beta-lactam class, even though one's a cephalosporin. And then we had a group of non-treated animals. They were our control group. Okay. And you can see that we kind of broke out pretty evenly across our study in the 3 different categories. Okay. So why do we care? Why is it important for us to look at these non-aureus staphs? Okay. There's been several studies that have looked at multiple herds over time and whatnot. And we found that with major pathogens we have a pretty dramatic milk yield drop. We have an increase in somatic cell count in these animals. In some situations, in some studies, they found that non-aureus staphs don't have any effect on milk yield. Okay. Other studies have shown that we see increased losses. and also in loss of cheese yield when we take the goat milk and put it into cheese products, and also poor quality cheese products as a result of both the bacteria and the somatic cell counts that are present. So from a food quality perspective, we really want to control these infections. Probably put too many of those slides in there. So what can we do? So there's been several studies that have looked at treatments, and this is kind of where we got to our case. In this case, we're going to use what we call long-acting antibiotics, okay? Where only one treatment is required, and we think that we can get a pretty high cure rate. The things that we have to know is that we know we're going to shorten the lactation up. We really need to know from a residue prevention standpoint where our next kitting date is. And this is probably the most important component of thinking about implementing an antibiotic therapy program for controlling subclinical mastitis in dairy goats. Is if we're going to prevent residues, we're putting a long-acting antibiotic in that gland, and we know that if we wait a period of time, that our withdrawal time is going to be pretty consistently short with one of the two antibiotics that we're using. But if we don't know the actual kitting time, we may have a very shortened interval compared to what we think it might be. So record keeping becomes a very important component of this, knowing breeding dates, knowing actual stages of gestation in order to accurately predict when these goats are going to have their next set of kids. And then we're going to have some costs associated with it. Okay, I got an extra slide in here. So jumping forward to our study results. So we had, again, two different long-acting antimicrobials, a cloxacillin product. This is also called dry clox by another manufacturer, a cephalosporin product, which is a narrow spectrum cephalosporin product called Tomorrow. Both of these are dry cow antimicrobials. So they have a large volume of antimicrobial present and have been on the market for a long period of time. So we utilized these two products in comparison to not treating our non-aureus staph products. We had about a 30% increase in cures compared to doing nothing. So number one take-home point is if we do nothing, about half of the infections, non-aureus staph infections that are present at dry off will cure, okay? But there's still about half that didn't cure, that if we would just do a simple antimicrobial intervention, we could get a very nice improvement in cure rates, okay? Now, by itself, this is not going to improve a milk quality disaster, but this is one piece of one tool in the toolbox that the dairy cow community implemented years ago in order to improve milk quality. Okay, there's still all the hygiene, the milking procedures, all the other stuff, the nutrition that needs to be taken care of. But this is one piece of one tool in the arsenal that could be utilized to help bring in more does that are clean at the next kitting period. Okay, does it prevent new infections? No, absolutely not. And we know this is the case in dairy cows also. Despite the fact that these are long-acting antibiotics, the amount of drug residue that's present towards the end of the gestation or the end of the dry period, which is kind of the same thing here, is almost minuscule. So we know that we're not using this to prevent new infections. So we need to put these animals in a clean, dry environment to prevent them from getting new infections during the dry period also. Okay, so safety, again, we've already talked about this. We need to know breeding dates, okay? Some way to age them, having hand breeding or AI, having fetal aging with ultrasound. Most veterinarians can do that today, is super important. You need to make sure that if you're going to implement this antimicrobial and minimize the exposure in the food on the backside, that we need to have an established dry period length based on the next expected parturition. Okay, I'm going to harp on this one again. Records, records, records. It's not only important for you to prevent a residue, but it's also important for you in the future, should there ever be a violative residue, to help investigate the situation, to help prevent residues going into into the food chain. Okay. I think it's also super important to make sure you're identifying these animals when they are treated, and separating them from the lactating animals that are going into the food chain to prevent a residue violation. So we've already talked about how to get a withhold time. It's not labeled, so your veterinarian will be able to help you with that through a FARAD inquiry in order to do the appropriate withdrawal time. For these two antimicrobials, one's shorter and one's much longer than it is on the cow side. Okay. What about feeding that waste milk to kids? Can I take this antibiotic laden milk and feed it to kids? It happens. It's going to create at least some temporary antimicrobial resistance if we would monitor the fecal pathogens that are present. That generally subsides in 21 days, but that doesn't necessarily mean that the antimicrobial resistance genes that may be present in those fecal bacteria may not persist for a longer period of time. So we know that if we do feed this treated milk to kids with antibiotics in it, it is going to generate a little bit of antimicrobial resistance in those animals. Not sufficient amount of work has been done that I'm aware of on the goat side to really know for sure that this is a safe practice. Okay. And then we're going to test the milk before these animals go back into the milking string, either using a charm test, which I showed you earlier, or a Delvo test. Again, consult with your veterinarian, and maybe also your local processor for test recommendations. It's very important when you ask the veterinarian or the local processor for guidance here about testing milk, that you understand that these test kits do not detect all antimicrobials that we could use. So as an example, the charm kit that I showed you earlier can only test drugs like penicillin and ampicillin and cephalosporins, and not things like tetracycline, as an example. So you need to know, and you need to share with your veterinarian or processor when you're getting these recommendations on what drug you are using. Okay, so from our research, when we looked at milk residues, if we use the Tomorrow product, we could barely find it when we took these does through a 60-day dry period. That's what the farms were prescribing. Okay, on the 6 or so days after parturition. On the cloxacillin and the orbenin side, we could find a little bit more. Okay, 10 of our 22 animals, we found none, but 12 of the 22 had detectable limits past 100, out to at least 144 days. One animal shed drug residues for 144 days after she kidded, and that's when the point where we took our last sample was at 144 days after parturition. 144 hours, I'm sorry, 144 hours. On the meat side, with the Tomorrow product, we could find no residues in any of the tissues. On the dairy cow side, that drug has a 4-day meat withdrawal following a 30-day dry period. I think that's a safe recommendation for dairy goats based on the research that we have. But again, your veterinarian should consult with FARAD. On the cloxacillin side, we saw the exact opposite. We saw that the drug persisted in liver and kidney for quite a long period of time. And when we took our residue data that's demonstrated here and put it into some software that the FDA provides, that software predicted an 85-day meat withdrawal. So if you're going to do dry therapy and are looking at options, I certainly would consider cefepime to be a more viable option than I would consider the cloxacillin product based on the data that we generated. From an antimicrobial susceptibility standpoint, and this is kind of combining all the data that we have that from the animals that received antimicrobials, um, and the top box of samples are the isolates from the samples before the animals were dried off, and the bottom box down here is the samples from the isolates after they kitted. Okay. Um, and we went through and we did an antimicrobial susceptibility test to a barrage of different antibiotics that are in a readily available bovine mastitis antimicrobial susceptibility test that's commonly marketed, and compared the results before and after kitting. And what we're really interested in here is, does the use of a long-acting antimicrobial have any impact from development of antimicrobial resistance? And the way to kind of know this is compare either the MIC 50, which is the drug concentration that inhibits 50% of the bacterial growth, or MIC 90, which is the drug concentration that inhibits 90% of the growth. Compare the same column and line for the same drug above and below. And you can see that almost in almost all cases, this one had about a one-fold dilution. So it's 0.25 here and it's 0.5 here. In all situations, we saw those same results. Okay. We get concerned about the development of antimicrobial resistance when we start to get 2 or 3-fold increases in these MIC 90s as an example. So our data, based on several hundred does from 3 states across the United States, high dairy goat producing states, shows that the use of these antimicrobials resulted in minimal development of antimicrobial resistance in the isolates that we harvested after kitting in comparison to the isolates that we harvested before kitting. And these were animals that had been treated and had the same bacteria present before and after. Again, these are all the non-aureus staffs. Okay, one more slide to finish up here. On the dairy cow side, we've gone from an approach to try to use less antimicrobials at dry off, because traditionally we used blanket dry cow therapy. Every cow that went dry got a dry therapy administration. And so we've been doing collaborative work with the people at Minnesota and Cornell, and looking at whether or not selective dry cow therapy based on some mechanism to identify animals that are infected, would that be a viable option for us to reduce antimicrobial use? Okay. So a couple of things. In dairy cattle at dry off, the subclinical infection rate is much lower. We're talking 85% of the animals that go dry have no bacteria present at dry off. So there's a much lower level of subclinical compared to dairy goats, which we think it's at least 30 to 40%. So more at least twice as high. Bacterial populations are similar. That's the reason that the drugs that we used in dairy cows kind of were great choices to go into dairy goats with. But I still think there's enough bacteria subclinical infections present to make it worthwhile to do it in dairy goats. Okay. And if you're going to do this, you need some kind of a method to validly discriminate infected versus uninfected animals. So using CMTs or somatic cells or bacteria culture in order to pick the animals out that are infected versus not infected would be a strategy that you would really need to implement. And I've seen some farms just try to do some algorithms where they're using previous infections from a clinical standpoint, and that hasn't been tremendously successful. And especially considering that dairy goats rarely have clinical mastitis, it would make it even more difficult. So we need to figure out some algorithm to discriminate which animals to treat and not treat. So maybe down the road, this might be a more in-depth conversation. With that, I need to recognize our USDA partners who funded the research that primarily I provided in the example here. Again, this work has parlayed itself into our sustainability grant that Jen mentioned at the beginning that we're just getting off the ground right now. It's a very large project, so we're pretty proud of the ability to continue this information to make the work that we've done in the past continue to be viable or available for those going forward. And with that, I've got my references that can be shared if anybody has questions or about those. Feel free to reach out, and Jen can share those if necessary also, or any of the extension staff. And that's my last slide, and I will offer up questions now.
All right. Thanks, Dr. Gorden, for that presentation. I really appreciate the clarification on the antimicrobials and comparing it to dairy cattle and how that relates to dairy goats. I think it was a very well explained presentation here today. So I have my colleague Fred Hall on the Zoom as well, and he's going to help monitor questions. So if you do have any, please type those into the chat. I also did put in the chat the webinar evaluation for today. So if you could go ahead and click on that before you log off here today, that would help us in our evaluation of the program, as well as any upcoming webinars that we have. So Fred, are you seeing any questions in the chat?
Shauna asked, what about Thailand 200?
Yeah, I saw that. Specifically, Shauna, and I apologize if I didn't pronounce your name correctly. What about Thailand 200 are you inquiring about? And as she responds, if she's still on.
We are
And
a small group.
yeah.
Go ahead and unmute and just ask directly.
She's still on. So Thailand 200 is an older antibiotic. It's in the how long it stays in goats. I have no idea. So it's a macrolide antibiotic. Okay, so it's similar to the Z-Pak that humans get, or Draxxin, or some of the more common respiratory antibiotics that we would use in small ruminants also. So the characteristics of that particular family of drugs is that they have a very good penetration into the tissue of interest. And so respiratory and mammary gland would be two places where that drug would concentrate and persist as a drug class for a long period of time. We have probably zero data on Thailand 200 in goats. But I can tell you one of the data that we do get through the diagnostic lab in our residue analysis laboratory down here is the use of other similar drugs, similar class drugs in dairy animals before they have their first calf. So we have a heifer as an example that has respiratory disease. They give that drug to the heifer. She calves a month or 2 months later. We've taken milk samples from those cows 1 to 2 months after calving, and we can still find the drug present in the milk. So if based on the drug class, I would say that it probably persists for a long time. Okay. Now, Thailand by itself has a shorter withdrawal time than do the other ones. So there are some characteristics that are different. But if you're giving it to your goats for persistent cough and they're dairy goats, I would not be consuming the milk for those animals for a period of time. You really need to talk to a veterinarian about that, because I can't, not being your veterinarian, I can't give you a withdrawal time because we don't have a veterinarian client-patient relationship.
Dr. Gorden, we've got another question from Francisco. Can we use the California test to diagnose mastitis in goats? And if so, what are the limits?
So the California mastitis test can be used. The problem with the California mastitis test in cows or goats, it doesn't matter, is that it's a subjective test. It doesn't give us a 1, 2, 3, 4 number by putting the milk and the reagent together. We have to look at it and go, how snotty do we think this looks in comparison to normal milk? And then subjectively put a 1, 2, 3, 4 score on that. And so when you look at milk from cows, and the range of somatic cell counts that are associated with those individual scores, you're going to get very wide variation. Okay. So the way my predecessor, Leo Tim's former extension person here at Iowa State, has always taught me to analyze CMT. It doesn't matter what it is. It's a positive or negative result. Okay. So we generally think that in cattle, that if they have a somatic cell count higher than 200,000, there's probably an infection there. And so if we see any change in somatic cell count, and I'm sorry, any change in CMT, we have an infection present in that milk. Okay. You're right. Goats have a higher somatic cell count, and they have some physiological components that are associated with those cell counts that are not related to an intramammary infection. Okay. And that becomes a limiting factor for its use in goats. I would say that if you get a positive, there's a chance there's an infection. I would say that the chance that the infection is true compared to a cow is less. Okay. I think the most accurate diagnosis you can get with a CMT is negative, because that's associated with a low cell count.
So Dr. Gorden, as a follow-up to that, then if they were using the CMT and they thought it came back positive with a chance of infection, would the best route be to take a culture?
Yeah, exactly. Get a sterilely collected or an aseptically collected sample, which is easier to do in goats because of the fecal consistency. You don't get the splashing of manure onto the teats. And do a culture. So either through your veterinary clinic, local veterinary clinic, diagnostic lab, DHI testing centers offer some forms of doing bacterial identification. They oftentimes will offer PCR technology, which is slightly different and a little bit more expensive, but it will get you that result also. And in any case, what you're probably gonna have about a week of turnaround time, depending on what lab you go to and getting that result.
Shauna asked us, what's a good wormer we can give our dairy goats that won't affect their milk?
Yeah. So that, so I am not your veterinarian again. So I don't have a veterinarian client-patient relationship with you. So I can't make those recommendations in specific products. Okay. There are some of the injectable wormers that will get in the milk, the ivermectins, and there's some families of those that won't. But and there's also some of the orals that in dairy cattle are approved for non-lactating species. I'm sorry, that are approved for lactating animals. Sorry. So work with your local veterinarian on that. I'm just handcuffed on what I can do as far as those recommendations, because I'm not there to work with you if there's an adverse event or whatever. That's a restriction on our license.
And I had a direct message come in earlier about leading back to the residues. While the residue is being sent to the St. Louis lab, I think this was in regard to the meat residue. What is done with the animal that has already been ready to be slaughtered?
Yeah. So if the plant who collects those tissues and sends them to the St. Louis lab, well, no, if the plant collects tissues for further testing that they have to send to the lab in St. Louis, that animal needs to be taken out of the food chain until the results are available. Okay, so it'll be moved into a cooler that is not in with the same animals that are going onward for further processing until that test result is available.
We've got a question here. In your slide, it says ionophores were not an important use drug. Is that reviewed so at some point in the future they may become an important use drug?
Yeah, so that relates back to the very first or second slide I showed. That was the medically important antimicrobials. Okay, medically important antimicrobials to human medical doctors. Okay, and there's no use of those ionophores in humans. They work because they alter bacterial growth in the rumen, which we don't have. So they will not be considered to be medically important in humans.
Very good. Final question on my side is sheep and goats are culturally consumed. So going into an export market, is there conflict between US requirements and some export countries?
That's a great question. That's a question I cannot answer. I don't
Okay.
know.
Very good.
You would have to contact the USDA, Food Safety and Inspection Service. They would be the group that would be working with international markets to know what the regulations are.
That's all I've got, Jen.
Yeah, I'm not seeing any other questions coming into the chat, but I thought those were all very good questions. And this is being recorded, so we'll get it uploaded to our YouTube channel here within the week. And so you can preview it. I'll send out a follow-up email. And so you'll know that it's live and can go back. If you have any follow-up questions, you're certainly be able to reach out to any one of us for any additional information. This is the last of our webinar series for the spring. So we're going to take the summer off. So no webinars in June, July, and August, and we'll be back in September. And so I'll send out a notification when we have that topic identified and date put on the calendar. So we look forward to seeing you all again in the fall. And again, please reach out to us with any questions. Thanks, Dr. Gorden.
You're welcome. Thank you.